We move on to antigen, antibody, and antigen antibody reaction. Last time what we had finished? 30 minutes. Okay. Now move on to the antigen antibody reaction. So what is antigen? Antigen is defined as when injected into the body, it should be able to produce either cell mediated or humoral immune response. It should be able to produce either CMI or AMI. CMI is by T lymphocytes, AMI by antibody mediated. Okay. It should be foreign to the body, and it should be antigen ideally should be able to provoke immune response. It should be foreign to the body. It should be able to provoke immune response. So proteins are better antigen compared to carbohydrates and lipids. Proteins are the better agents compared to the carbohydrates and lipids. So partial antigen or incomplete antigen is called as hapten. Partial antigen or incomplete antigen is called hapten. The hapten can be made complete antigen by tagging on to adjuvant. Most commonly used adjuvant is tubercular protein Pruent's adjuvants, which is tubercle bacilli in mineral salt. Tubercle bacilli in mineral salt. Now there is there is antigen present on the RBCs. Depending on the antigen present on the RBCs, Landsteiner classified them into A group, B group, O group, and AB group. O group is divide of any antigens on their surface. They are, in olden days, we used to call universal donor, and AB is called as universal recipient. There are HL antigen which are present on the leukocyte. Now they are called as major histocompatibility antigen, MHC, class 1, class 2, and class 3. Class 1, class 2, class 4. So they play a very important role in tumor immunity and organ transplantation. They play a very important role in antigen present. They process the antigen present into the antigen present. They are important in recognition whether it's self or non-self. The only antigen presented with MHC molecules are treated as foreign and cleared from the body. That is the importance of MHC molecules. Now moving on to there are cross-reacting antigens which is shared by some of the mammals, vertebrate animals, some of the bacteria and all those things. There is something called there are hidden antigens, or for example, lens and spermatozoa antigen. When they get exposed, they are not exposed during embryonic life. There are no antibodies against lens antigen and spermatozoal antigens. When they leak into the human system, they give rise to autoimmune orchitis.
ಆಫೀಸರು ಕರೀತಾರೆ ಸರ್, ಅದಕ್ಕೆ ಹೋಗಿದ್ದೀನಿ. ಇದು ಕೊಟ್ಟಿದ್ದಾರೆ ಸರ್. ಬೇರೆ ಒಬ್ಬರು ಯಾರೋ ಸ್ಟೂಡೆಂಟು ನಮ್ಮ ಬಯೋಮೆಟ್ರಿಕ್ನಲ್ಲಿ ಬಯೋಮೆಟ್ರಿಕ್ ಹಾಕಿದ್ದಾರೆ ಅಂತ ಅವ್ರು ಕಾಲ್ ಮಾಡಿ ಇಲ್ಲಿ ಕರ್ತೀನಿ ಸರ್.
Okay, now so antigens, there are hidden antigens like lens antigens, and when any injury to the lens material leaks into the system, can give rise to ophthalmitis and autoimmune orchitis. Blood antigens are very important in the crime scenes. If they put dog's blood, that sheep blood, we test with a human anti-serum, they do not react. So it's a lot of forensic implication. Uh, so this is about antigen. So you remember HLA antigens and sequestered antigen, hidden antigen. So the antigen is multivalent. It can react here, react. Very small area of antigen combined with the antibody. Very small area of the antigen comes in contact with the antibody. Antigen comes in contact with the antibody. The place, this particular area in which the antigen react with antibody is called as epitope. The place where antigen react with antibody is called as epitope. Hold like this. The firmness with antigen antibody reacts. The firmness with antigen antibody react is called as avidity. The firmness with antigen antibody react is called as avidity. Now coming to the, we always use the term titer. What is titer? Titer defined as highest dilution of serum. Titer is defined as highest dilution of serum. Antigen reacts with antibody in observable manner. Titer is defined as highest dilution of serum in which the antigen reacts with antibody in observable manner. Highest dilution of serum in which antigen reacts with antibody in observable manner. For example, if you can see the agglutination in 1 in 2, 1 in 4, 1 in 8, 1 in 16, and you do not see in 1 in 32. So this becomes the titer. So you don't see the agglutination in 1 in 32. Titer is the highest dilution serum in which you see the antigen antibodies reaction observable. So the two terminology which we often use in serology, specificity and sensitivity. Specificity and sensitivity is most commonly used terminology we employ in describing a test. So, specific is defined as any test in which antigen reacts with only homologous antibody. Specific homologous antibodies. Homologous antibody. Antigen reacts with the specific homologous antibody. Antigen reacts with the specific homologous antibody. Sensitivity, the antigen reacts with both homologous as well as heterologous antibody. Homologous, heterologous antibody. Homologous as well as heterologous antibodies. Homologous as well as heterologous antibody. Specificity and sensitivity are inversely proportional. The test which is more specific is less sensitive. The test which is more sensitive is less specific. So now you know the definition of epitope, avidity, specificity, and sensitivity. Now, as I said, now moving on to the antibodies, you remember the mnemonic gamed. These are the 5 classes of antibodies. These are 5 classes of antibodies. So, antibody is made up of A pair of a pair of heavy chain and pair of light chain held together by disulfide bond. A pair of heavy chain, a pair of light chain are held together by disulfide chain. So B cells, B lymphocytes, which are derived from bursa fabricius or bone marrow, which get transformed into plasma cells. Plasma cells are the mother of all immunoglobulins. Plasma cells are the mother of immunoglobulins. When you do a serum electrophoresis, it go into three bands: alpha, beta, and gamma. So all immunoglobulins are gamma globulins. All immunoglobulins are gamma globulins. All immunoglobulins are gamma globulins. So IgG is a pair of heavy chain and pair of light chain. On pepsin digestion, it is broken into two parts. One is part C, fixes the complement, and two FAB fragment. 1 and 2. Two FAB fragment. Two FAB fragment. So IgG can react with two antigens. Bivalent. Bivalent. Now moving on to the second antibody, that is IgA. Sorry, this is IgM. It is present most abundant 90%. It is both intravascular, extravascular. This is IgM. IgM is called as pentamer. It has got 5 molecules of IgG. It has got 5 molecules of IgG. And it is present only inside the blood vessels. It is present only inside the blood vessels and protects us from the bloodstream infection. Bloodstream infection. IgM is a very important antibody because it's an acute antibody. It appears immediately after infection. Whereas IgG is a late antibody. IgG is a chronic antibody. This is a acute antibody. IgG is a chronic antibody, late antibody, whereas IgM is a acute antibody. IgG is present both intravascularly as well as extravascularly. 90% of immunoglobulin is made up of IgG, most abundant antibody. It is the only antibody which passes the placenta. It's the only antibody that passes the placenta and protects the fetus against intrauterine infection. Protects the fetus against the intrauterine infection. If you detect IgM in the fetal life earlier than 20 weeks, then suspicion goes in favor of intrauterine infection. So remember this mnemonic torch. Toxoplasma rubella, Toxoplasma cytomegalovirus herpes. Torch, Toxoplasma, these are all congenital infection. Toxoplasma rubella, cytomegalovirus herpes. These are all transmitted from mother to fetus during, this is called vertical transmission. This is also called as vertical transmission. This is also called as vertical transmission. So if you detect IgM during fetus earlier than 20 weeks, strongly goes in suspicion of. So to summarize IgG and IgM, IgM is a pentamer. and takes role in the agglutination reaction. It has got 10 antigen combining site. It is present inside the blood vessels. It protects us from the bloodstream infection. IgG is a late antibody, and it is the only antibody. It is a very important question that will be asked in your NEET PG examination. IgG is the only antibody which passes the placental barrier and protects the fetus against the intrauterine nectar. IgG is a chronic antibody. It's the most abundant antibody. It is present both inside the blood vessels as well as the outside the blood vessels. So IgG has got 2 antigen combining sites. IgM has got, hold like this, 10 antigen combining sites. IgM has got 10 antigen combining. So next is IgA. It has got 2 molecules of immunoglobulin. Held together by secretory piece. It has got, hold like this, 4 antigen combined. It is present in the all secretions of body: saliva, sweat, sebaceous gland, gastrointestinal tract, genitourinary tract, vagina, all. And it's called as local antibody. And it neutralizes the bacteria, viruses at the site of entry. Virus mostly taken care by T cells, but whatever extravascular infections get neutralized by the IgA. It's called as local antibodies. Present in all respiratory secretions. So people who are suffering from bronchial asthma, it's a type 1 hypersensitivity reaction, they lack this IgA antibody. There is more of IgA antibody, there is a less of IgA antibodies. Please remember this. The next moving on to the IgE. IgE is also called as homocytotropic antibody. Homocytotropic antibody. IgE is called as homocytotropic antibody present on the mast cell. So it's one of the antibodies where antigen antibody reaction occurs on the surface of the mast cells, resulting in release of vasoactive amines, especially histamines. They got granules, histidine granules, so they release histamine. So they are responsible for anaphylaxis. It is opposite terminology for prophylaxis. Prophylaxis is protection, whereas anaphylaxis is destruction. Prophylaxis is protection, anaphylaxis is destruction. So what is hypersensitivity is defined as exaggerated immune response towards already sensitized antigen, resulting in tissue death or injury, is called as hypersensitivity. You should remember the mnemonic acid. The type 1 is anaphylaxis, allergy, and atopy. Allergy, atopy, bronchial asthma, type 1 hypersensitivity reaction. Atopy, atopic dermatitis, and anaphylaxis, very common with penicillin injection as well as honeybee bite, insect bite. Next is cytolytic cytotoxic. Type 2 reaction is cytolytic cytotoxic. Type 3 is immune complex mediated. Generalized, it's called serum sickness. Localized is called as Arthus phenomenon. Type 4 is called as delayed hypersensitivity reaction. Delayed hypersensitivity. It is mediated by CM. It is mediated by cell-mediated immunity. It is mediated by cell-mediated immunity. CMI, it is mediated by cell-mediated immunity. Now, one more has been added, in which both T cells and B cells take a role, antibody as well as lymphokines. This is a mixed type. The 5th one has been added. Now, IgD is similar to, it has also got one molecule of immunoglobulin, IgG. It has got, nothing much is known or described about IgD. So in nutshell, We'll summarize antibodies. Two antigen combining sites. It passes the placenta. 90% of immunoglobulin is made up of IgG, and it's a chronic antibody or late antibody. Chronic antibody or late antibody. Now IgM, it has got 10 antigen. It is present inside the blood vessels, protects against bloodstream infection, and it is a acute antibody. Early antibody or acute antibody. Early antibody or acute antibody. IgA, secrete antibody. It has got 4 antigen combining site. It is present in the secretions. It gives local immunity. Decreased in asthma. All asthma and allergic disorders. IgE play important role in anaphylaxis. It is present on the mast cell, and it is also called as homocytotropic. And reagent antibody. Homocytotropic and reagent antibody. Homocytotropic and reagent antibody. Now, IgD similar to IgG, it has got 2 antigen combining site. It has got 2 antigen combining site. Similar to, so we'll summarize in a nutshell. IgG only antibody which passes the placental barrier, chronic antibody, late antibody, most abundant antibody. IgM inside the blood vessels protects against the bloodstream infection, acute antibody, early antibody. IgA is present in the secretion, local immunity at the site of entry. Ig is a homocytotropic, important role in anaphylaxis. Exaggerated immune response towards already sensitized antigen resulting in tissue death or injury is called anaphylaxis. Opposite terminology of prophylaxis. IgD is nothing much is known, similar to that of IgG. With this background of antigen antibody, we move on to the antigen antibody reaction. Move on to the antigen antibody reaction. Antigen antibody reaction, you have to repeat with me. R, agglutination, precipitation, complement fixation test, neutralization test, enzyme linked immunosorbent assay, radioimmunoassay. Agglutination, precipitation, complement fixation test, neutralization test, radioimmunoassay, enzyme linked immunosorbent assay, and immunofluorescence test. Immunofluorescence test. Now, what is the difference between agglutination and precipitation? What is the difference between agglutination and precipitation test? Agglutination happens when antigen is in particulate nature. Agglutination occurs when antigen is in particulate nature, insoluble or particulate in nature. Precipitation occurs when antigen is in soluble nature. Precipitation occurs when antigen is in soluble nature. Antigen is in soluble nature. Agglutination and precipitation. Next is antigen is good in detecting antibody. Precipitation is good in detecting antigen. Precipitation is good in detecting antigen. Precipitation is good in detecting antigen. This precipitation test is converted into insoluble antigen by tagging onto the inert particle. For example, latex, tagging antigen onto the inert particle. Example of latex agglutination tests are ASLO, anti-streptolysin O, C-reactive protein, and rheumatoid arthritis factor. Rheumatoid arthritis factors. So next class we'll take agglutination test.